So we're going to go ahead and get started. First, Manal, are you first?
Yes.
So Manal's going to talk to us. Manal is a managing director of Prevention Institute, where she works collaboratively to achieve health and equity, with a particular focus on the role of built environment on health and safety and well-being. Her work emphasizes policy and community-based approaches and demonstrates an overarching commitment to working with under-resourced communities to foster health and safety. Prior to her work with the Prevention Institute, she received her MPH in epidemiology from UCLA, where she was inducted into the Lota chapter of the Delta Omega Honorary Society. And we're so happy and privileged to have you with us today. So welcome.
Thank you. Good afternoon, members of the committee. Thank you for inviting me here today to speak to you about place-based factors and the role of community engagement in achieving equitable health outcomes. My name is Manal Aboelata, and I'm Managing Director at Prevention Institute. This is a picture of our building in Oakland, and it is a national nonprofit organization as well as a community-based institution and a hub for primary prevention practice and health equity. In the 18 years that I've been with Prevention Institute, I have been really seeing a transformation in the field of public health. There is so much more clarity and recognition about the important role that the environment has on health, not just in terms of air, water, and soil, but also in terms of the built environment and place-based factors and the impact that they have on behaviors that also influence health and safety. And this recognition, as you all know, is particularly important as we grapple ever more with chronic diseases, long-term conditions, and quality of life issues. Back in 2003, Prevention Institute was commissioned by the National Center for Environmental Health at the Centers for Disease Control and Prevention to prepare a series of case studies that would really illustrate community-based changes to the built environment and, where possible, report on health behavior changes or changes in health outcomes. The director at the time was a man named Dr. Dick Jackson, who really, I think, saw that the field perhaps was too narrowly focused on dealing with illnesses caused by one toxin at a time. And I think in his view, perhaps, that the field was failing to capture the big picture, that the way communities were designed was literally harmful to the health and well-being of children. So we did a scan of the United States and really landed on 11 breakthroughs in the built environment and linked those to the available evidence at the time. There was the community of Upper Falls in Rochester, New York, that organized to have a grocery store replace the last grocery store that had been burnt out in their community. And there was emerging evidence at the time that increases in the number of grocery stores could improve healthy food consumption and reduce the consumption of saturated fat for each additional grocery store within a census tract. There was also the people in Denver, Colorado, who worked with a local nonprofit called Denver Urban Gardens and partnered with the University of Colorado to build community gardens and monitor their impact on mental health as well as physical health, particularly in low-income communities and communities of color, as well as for women who had been dealing with domestic violence. And then there was the story of the very well-disciplined, well-organized community campaign led by the Community Coalition in South Los Angeles to reduce the number of liquor stores that residents were sick and tired of dealing with. And what we knew from data from the World Health Organization was that limiting the number and placement of liquor stores led to reductions in alcohol-related problems. And with some researchers at the nearby Loyola Marymount University, they found a reduction in crime as a result of their efforts to either close or prevent liquor stores from getting conditional use permits so that they could open up again after the rebellions in South LA. And we also shared the great work of the Boston Lead Safe Yard Project, which cleaned up contaminated soil in and around the older homes in Dorchester and Roxbury, Massachusetts, for predominantly African American and lower income families. Each of the 11 profiles that we told and showed shared an inspiring story of transformation, as well as improvements in the built environment, and in all cases, I think, elevated the dedication of people committed to making changes on issues that mattered to them and in their lives. And these stories mirrored some parallel work we were doing, first with support from the California Endowment, and then later under the auspices of the Office of Minority Health, to really identify what are the critical factors in the community environment that need to be addressed to foster health and safety. Over time, this work involved an in-depth review of the literature, as well as some work with expert panel and input that led us to a set of interrelated factors in these clusters that we call equitable opportunity, people, and place. And these evidence-based factors really form the basis of Thrive, Prevention Institute's tool for health and resilience in vulnerable environments, which really provides communities and has provided communities with evidence-based framework for local action. And one of the things that I think it does well is makes explicit the notion that creating healthy communities goes beyond the purview of public health and healthcare working alone to include other disciplines and sectors like transportation, parks and recreation, housing, and so on. And what we learned through that literature review and the local piloting is that there are many aspects of the physical environment that have a fundamental impact on health and well-being. It's not just one or two things, but the combination and synergy of these things working together in people's lives. For example, the look, feel, and safety of a neighborhood has an influence on health and health behaviors. Whether or not a community has parks and open space, the quality, accessibility of those parks and open space, to what extent they're well maintained and opened for children and families to gather in, play in, and be physically active. Another key place-based factor is getting around. To what extent do residents have the ability to safely, affordably, and with dignity get around their community? Not just on transit, but also through active transportation, like in Seattle, where their Department of Transportation has been making a concerted effort over decades to reduce pedestrian fatalities and injuries while also increasing walking and biking. Another critical aspect of the built environment is also involves housing that's fair, safe, healthy, and affordable and secure. We also have found some literature to suggest that what's sold and how it is promoted has impacts on health behaviors, also perceptions of acceptable norms, and that influences health behaviors and outcomes. And of course, as you all know, the air we breathe, the soil our food is grown in, and the water we drink are among the most basic aspects of a healthy and equitable community. We also found some evidence to support the importance of arts and culture to health, as well as people's feelings, real and perceived, about the safety of their communities. And this is an area where I imagine that the published literature could stand to grow even further. But I still think the story of Philadelphia Mural Arts Program is worth telling because it represents a beautiful example of how policy, people, and place converge. What started as an anti-graffiti program really blossomed into a major citywide, community-rooted public art program that transformed blocks and neighborhoods by telling stories through murals that evoked history and heritage. And through the eyes of the executive director, Jane Golden, it's clear that the model didn't just change the sides of building walls, but also touch lives. She says that the program's, the program's grassroots, bottom-up approach also works to empower residents, for whom oftentimes art in their neighborhood equates to an occasional billboard with alcohol and tobacco images. Murals not only transform neighborhoods, they often become the heart of community revitalization. And what I love about the Philadelphia experience is that it really encapsulates this notion that people and place are intrinsically linked. Without the mural, we wouldn't be a community. Once that mural was complete, neighborhood youth began helping their elders keep the area in front of the mural clean. Sometimes designing and producing a local mural begins a process of social connection and political activism that previously did not exist. But over the years, as I've thought about all these place-based factors and the inspirational stories of neighborhood-level changes to the built environment, I've had an aha moment. And that is that all of these place-based factors, transportation, housing, parks and open space, what's sold and how it's promoted, are rooted in a common system. And that system is our land use system. And unfortunately, in far too many communities, that land use system has created and reinforced pervasive inequities in the physical places where people live, work, and play. And that land use system is having a detrimental and devastating impact on people of color and low-income people who are marginalized and discriminated against through the current dominant paradigms in land use planning and development. And through our work, we are learning that whether people are working on building a park, whether they're working on getting a new bike path in their community, or getting rid of a polluting industry or a nuisance business, they have to commit to a long-term confrontation with the land use system status quo. Of course, this sounds daunting, but the good news is that the field of public health and others are really starting to get it, that many sectors have a key role to play, and multi-sector action can combine with community organizing and activism to create needed and effective changes in the built environment and the land use system. And so if our goal is to create healthy communities and better built environments, we are going to need a new land use system, new and improved, that is designed to produce healthy and equitable conditions and outcomes. Prevention Institute's current work in this arena draws upon both evidence and practice and posits 4 key strategies that we think will be critical for achieving improved built environments and more equitable planning and land use. These may be areas that the committee would recommend for further research and practice. The first strategy is to increase investments in infrastructure with a focus on driving dollars to low-income, historically divested communities. The second strategy will involve increasing capacity, both governmental and local organization capacity and skills for effective community engagement in planning and land use decisions. In our chapter in the text, Making Healthy Places by Dick Jackson, Howard Frumpkin, and Andy Dannenberg, we discuss the research and benefits of community engagement in planning and built environment decisions. It's really a basic element, not only for better process, but also for better outcomes. In this context, we describe community as engagement simply as when all people within a defined community have a meaningful opportunity to provide input on a project or a process. And much more than simply being something that's required by government or something that's nice to do, community engagement can positively influence how streets are designed, where retail outlets will be located, what services and products are available, how dense new developments will be, and to what extent infrastructure like affordable housing, parks, or public transit will be available, affordable, and accessible to residents. One key clearly is about building relationships early in the planning process, but as we've learned, it's also the capacity to nurture and maintain these relationships throughout the process, either through a project or a long-term planning process. Too often we have heard that the system shuts down on community groups that are interested in improving or changing the built environment or land use. And as one of my public health heroes, America Bracho, notes, community engagement is when truly you involve people in creating a mechanism for themselves to define and create change. And this is a fundamental issue of equity in and of itself. The third key strategy that we think could really improve the land use system is to build upon effective place-based interventions and pilot programs to influence and create policy. Too often, health-promoting infrastructure like a new park, a new garden, affordable housing is an exception to the rule. People need to get a waiver to do the healthy and safe built environment intervention. Instead, we need to make sure that health-promoting infrastructure becomes the rule and not the exception, especially in low-income communities and communities of color. And finally, the fourth essential strategy for improving the land use system that undergirds virtually every place-based factor is to foster cross-disciplinary and intergovernmental cooperation on matters pertaining to health, equity, and sustainability, as well as resilient communities. Together, these four strategies could have a significant impact on the current land use system and move us toward a more just system that is capable of producing equitable outcomes more efficiently and more effectively. In sum, place-based factors are important to health equity. Evidence-based practices in healthy communities really do form the basis for us to continue down this line of work and research. Engaging community residents is both an evidence-based best practice as well as being good for built environment and land use changes. It's important to improved outcomes. And finally, changing the land use system can help us to accelerate and replicate best practices in changes to the built environment so that we're not doing them as one-offs, one community at a time, but as a matter of producing equity through systemic change. And I'm going to start to close the presentation with a great quote from my colleague Rachel Davis, who you all met, I think, at your first session. And she said, "By design, we have left whole communities behind. And by design, we can reverse that and reclaim our nation and all of its people." And one of the ways that Prevention Institute helps in redesigning our systems is in the development of tools and resources that build capacity in the field, like the Practitioner's Guide to Advancing Health Equity that we developed with the Centers for Disease Control and Prevention, like Thrive Tool, which I described to you earlier, as well as the Spectrum of Prevention, which really speaks to the importance of multi-level interventions if we are to achieve the comprehensive changes that are needed. Also, critical, developing effective coalitions, and our textbook on primary prevention, a welcome addition to schools of public health and medicine, and Collaboration Multiplier, which is a tool that has been designed explicitly to help multi-sector collaboratives come together, identify shared outcomes, partner strengths, and define joint strategies that can really define win-win strategies across sectors and systems. I want to close by thanking you all so much for your commitment to this issue and due diligence around place-based factors to achieve equitable health outcomes. Thank you.
So Beatrice, welcome. Beatrice is Director of the Healthy Communities South Region at the California Endowment. Dr. Solis is responsible for advancing the vision and strategic direction of the Foundation's building of healthy communities. Thank you for joining us today.